All right. For those of you who don't know me, I am Dr. Kristen Coles. I am a naturopathic physician, a licensed acupuncturist, and I am one of the team physicians at Spielsmith Natural Health Center. This is a picture of my partner, Dr. Lori Spielsmith, and myself at our clinic. And I know that many of you have been to our clinic, but if you haven't, great to meet you here, and we hope to meet you in the office someday in the future. We are located in Honolulu, Hawaii. And I will have our contact info at the end if for some reason you needed our phone number or you wanted to contact us. Okay, so because I went through my intro slide really fast, this is the Anatomy of Sleep lecture and its role in patient health outcomes. And here we go, we're going to dive in. So let's talk about why I wanted to do a lecture on sleep. And this lecture today is a combination of a lecture that I presented to physicians across the country at the annual American Association of Naturopathic Physicians conference that was in July. It was virtual. And the sleep lecture has been something I have been sort of working on for about 2 to 3 years. Honestly, I started becoming very interested in my own sleep and biohacking my sleep and then my patients' sleep. And I started tracking my own sleep almost 2.5 years ago with a wearable device. I'll be talking about that a little bit as well as we go along. But really, the key with sleep is that it is known as a foundation of health in naturopathic medicine. I'll be talking a little bit more about foundations of health in the next slide. The second thing is that diet and exercise have really had their moment in the wellness revolution, and I think that sleep is set to become the next sort of movement and revolution in the sphere of wellness. So I really want to impart what I've researched and what I know with all of you, so you can be on the cutting edge and you can use any of this for your own benefits. The other sort of third thing is the current events. You know, this is the year 2020. Here we are on a virtual webinar. For those of you who've been with our practice for many years, you know that most of the time we love to do in-person lectures for you all, but it's great that we have Zoom. It's great that we have so many people here and that we can do this. So we're in a pandemic. Many of us are in quarantine or stay-at-home orders. This has created a unique situation for patients' sleep and sleep hygiene. I would say that there is not a single patient that I have talked to in the last few months who hasn't made some sort of note when I inquire about how their sleep habits have changed. I would say the majority of them have noted that they've shifted maybe in an improper direction. Obviously, there's been a lot of anxiety. There's been anxiety about the fact that we have a health pandemic. There's anxiety about the fact that there is financial issues. There's so many levels of anxiety, and one of the things we know is that anxiety particularly can affect people's sleep. So in that same vein, the other thing I think that's really important is that, as we will get to see, sleep is a crucial piece to your immune system response. And there are very particular parts of sleep that we want to dial into that we know can make your immune system a much better immune system to deal with any type of immune situation that may come along. So you can see here we have a few covers. I love that Vogue in February 2020 had a headline, "Is a good night's sleep the most elusive wellness commodity?" So like I said, I think we're going to be seeing a sleep revolution. You heard it here first. So if anyone is unfamiliar with naturopathic medicine, I wanted to use this slide as a teaching tool and a reminder to everyone who is familiar with naturopathic medicine, kind of why naturopathic medicine is slightly different than conventional or allopathic medicine. The first thing is that we have something called a therapeutic order, which you can see on this screen. And a therapeutic order is what dictates to us as naturopathic clinicians a way to approach someone's health, a disease state, all of the above. And number one on this list, you can read it in the maroon, it says number one is establish the foundation for optimal health. That is the very first thing that is always at the forefront of our mind with any patient, any disease, any situation that we're meeting with. We are thinking about the foundations, which I'm going to talk about in the next slide, and really trying to make sure that all of those foundations to create optimal health are in line. From there, there's other things that we move through. We like to stimulate the body's ability to heal itself. We want to support and restore weakened systems. We may address physical alignment. We would do natural symptom control, possibly synthetic symptom relief, possibly high force interventions, or obviously referrals for those things. But you can see that we aren't going to start with number 6, which is a synthetic symptom relief. We're starting at the bottom of this, at the number 1. Even if maybe you don't know that that's where we're starting, that's where we're thinking in our head as naturopathic physicians. So, foundations of health, what are they? You could throw in so many things here, but I'm really kind of distilling it to a few key things. There's your diet, the nutrients you take in, the hydration level that you have. There's sleep. So, like I said, sleep is a foundation of health. That's why we're really going to delve into it today. And it is one of those things that in all of our patients, we want to be thinking about as a number one thing. Are they getting good sleep, quality sleep, efficient sleep, appropriate sleep, going through all the stages of sleep correctly? And that's what we'll talk about next. And then there's exercise or movement, the ability to move the body. And then there's a mental sphere, and that mental sphere could be thought about as mental, emotional, spiritual, connection. You could put anything in that sphere, but that's another very important key foundation to overall optimal health. All right, we are jumping in now to sleep. This looks complicated, but I put it here just for a few reasons. You don't need to get too concerned. I just want to show you the areas that you're going through when you enter sleep and the labels that are applied to some of the different parts of sleep. So let me backtrack and just say that it's only been about 50 years since we have actually known that humans and the brain go through different stages of sleep. And this is from the development of something known as an EEG, which is an electrical way to record brain waves. Once that was discovered, then we started to understand that sleep is not just a single thing that happens for 8 hours at night. There's very different particular things that are happening throughout that, let's just say 8 hours. So you can see that there's an awake stage, then there is a stage 1, a stage 2, stage 3, stage 4. The purple stages, stage 1 through 4, are also known as non-REM sleep. And then at the very end, we have REM sleep. We're going to talk about the distinctions between these. I also want you to kind of note the time graph at the bottom. So the duration of these different stages of sleep and how the brain enters into deep sleep is very systematic. So you will enter deep sleep, or stage 4 is deep sleep, and I'll get to that on the next slide. You will enter that stage in a particular fashion by going through stage 1, stage 2, stage 3. And then you will come out of stage 4 deep sleep. You can see in a little increments as well. You'll kind of climb your way back out and then enter REM sleep. So just a little bit to get you familiarized with these stages. Stage 1 is the lightest stage of sleep. There is muscle tone present in the skeletal muscle, and breathing is occurring at a regular rate. During stage 2, the heart rate and the body temperature drop. It's also characterized by something known as sleep spindles. This activates a particular part of your brain. Stage 3 and 4 can both sort of be considered deep sleep or N3 sleep. And this is your deepest stage of sleep. Now, if you look at I'm just going to call them squiggly lines because I don't have a pointer for you guys, but the squiggly lines above the stage 4 block, that is a representation of the waves, the brain waves that are occurring. And you can see there's a very notable difference in those squiggly lines versus all of the others. Those are known as slow waves. And slow waves and slow wave activity is directly correlated with something known as deep sleep. And we're going to be talking a lot about deep sleep because it is the most restorative and the most rejuvenating stage of sleep. Additionally, deep sleep is the most difficult stage to awaken from. It actually takes very loud decibels to awaken someone from this stage of sleep. Some people say that the amount needed to wake someone is the decibels equivalent to a jackhammer. So you can see once people enter this very slow wave deep sleep, it tends to be difficult to wake them up from. If someone does wake up during that deep sleep, they tend to experience something called sleep inertia that can last 30 minutes to an hour after they wake up, which means their brain is actually not online, and they will experience a lot of sort of brain fog, memory lapses, and fatigue if they're woken up during that particular stage of sleep. And then we have REM sleep. So I think deep sleep is my favorite stage of sleep if I had to rate them, but I will say REM sleep is a runner-up, and it's the second, I would say, most important. REM sleep is associated with dreaming. That is when you dream. You do not dream in any other sleep stage. It's also associated with memory consolidation, learning, and creativity. When you look at the brain activity, it's actually similar to being awake, but your skeletal muscles are atonic, meaning they cannot move, and your breathing rate is going to be altered, more erratic, and irregular. This stage usually starts about 90 minutes after falling asleep. And then as you're going through these cycles of stages of sleep during your entire night of sleep, you'll actually have progressively longer and longer stages of REM. 10 minutes can start with 10 minutes and then end up to an hour long. Another interesting thing to note for men is that penile erections occur only during REM sleep. One of the things that we will see in the next few slides is that REM sleep should be the final stage that you wake up from. So a few things that I will know to ask some of my patients about is, do you remember your dreams when you wake up? Because if you're having a proper sort of sleep cycle and you end with REM right before you wake, you should actually be able to note that you had a dream, that you woke up from a dream, or you remember a dream. And the second thing you can ask men is you can ask them about the penile erections they may have upon waking in the morning, because that's going to happen during REM sleep. Another interesting note is that most of the antidepressant medications tend to suppress REM sleep. So you'll see patients will have less REM sleep with antidepressant medications. Okay, so if we're talking about sleep anatomy, meaning all of the things that make up a good night of sleep, what are we looking at? So we're looking at something called sleep efficiency, and I'm going to go into depth in each of these in the next few slides, but we have sleep efficiency, we have sleep duration, we have sleep timing, we have the percent of time spent in REM, and we have the percent of time spent in deep sleep. So let's delve into all of these. All right, so we will start with sleep efficiency. And this is a measurement of the sleep quality. We're looking at the percentage of time that you're in bed that you're actually sleeping, total amount of sleeping. We're also looking how efficient is it? Does someone fall asleep within 20 minutes of trying to fall asleep? That's ideal. We're also looking to see that there are not long or multiple wake-ups throughout the night. Sleep duration. Fairly self-explanatory. This is the amount of time spent in sleep. Now, what I think is really interesting, and a lot of patients don't know this, is that a short sleep duration, or a less sleep than what someone needs, it's defined as less than 7 hours of sleep for the 24-hour period. So I know many of my patients are not getting that target 8 hours, and think that, they can operate on 6 hours or 7 hours of sleep, but, it's important to note that that short sleep duration is actually going to show up when you get 7 or less hours of sleep. All right, so those who know me know that I really love science and I love my research. So throughout this whole presentation, you're going to see studies popping up that I really think are interesting to share. Now, this study, it's labeled Sleep Habits and Susceptibility to Common Cold. It's 153 people, both male and female. What they did is the people who sign up for this, I don't even know what they're paying them, but basically you agree to have intranasal exposure to a rhinovirus. So they're basically taking a full-on virus and they're shooting it straight up your nose. Anyway, interesting, but they were monitored for an infection for the 5 days following that direct exposure. And what they found is, not everyone got sick. So that should be your first kind of light bulb going off. That's like, wow, you have a direct, large amount of viral exposure, and it was not 100% of the people who got ill. So that's very interesting to note. And then what they found is that this was specifically looking at sleep, and they found that participants who had less than 7 hours of sleep were about 3 times more likely to develop a cold than those with 8 hours or more sleep. They also found that those participants who had less than a 92% efficiency were 5.5 times more likely to develop a cold than those with 98% or more efficiency. So right there, this study is not that new. This is about a 7-year-old study. Right there, we directly can see that there is a known direct correlation between the amount of sleep and what our immune system does. And then we have sleep timing. Now, sleep timing is another really interesting one that I find a lot of patients or general public aren't really aware of. And the sleep timing is at the midpoint of sleep should fall between midnight and 3 a.m. Meaning, if you have 8 hours of sleep, you should have 4 hours before and 4 hours after. So that midpoint, if someone's going to bed, falling asleep at midnight and sleeping until 8 a.m., they are getting proper sleep duration. Maybe they're getting the proper sleep efficiency, but the sleep timing may be shifted. And the reason this is important is it goes back to melatonin. And melatonin is a hormone. We will be talking a lot more about it in sort of the second part of the presentation. But melatonin, which helps us fall asleep, it's secreted around 2 hours after bedtime, which is generally designed to release between midnight and 3 a.m. So if you're someone who stays up past that melatonin secretion time frame, they may miss the window to fall asleep or may lose the beneficial effects of melatonin on the brain. They may still fall asleep and have a good night's sleep, but they may actually be losing the benefits of melatonin, which we'll talk about what those benefits are in a little bit. All right. Then we have the percentage that we want to have target for REM sleep and deep sleep. On average, the amount of REM should account for 20 to 25% of sleep time. That could be 1.5 to 2 hours. And REM should be the final sleep stage before waking up in the morning. Then we have our percent deep sleep. And on average, we want 15 to 25% of the total sleep time in deep sleep, or maybe 1 to 2 hours. The slow wave activity or deep sleep should be at its highest in the first half of sleep. So what you should see, if you're tracking sleep in a certain way, you should see the bulk of deep sleep within the first 4 hours of sleep. So one thing that's really interesting to note about this is, and I have plenty of patients who will tell me that this happens, They sit down at the end of their day, they want to watch a little TV or they want to watch their show or YouTube or whatever it is, and they fall asleep on the couch. And then maybe they wake up an hour or so later, and hopefully they go up and they go to bed then. Well, one of the things that will happen if you start tracking people's sleep is if you end up doing something where you fall asleep because you're tired, your brain is trying to enter its sleep stages, and then you wake up, and you're probably waking up after that first like 10-minute REM cycle. It may wake you up. And what ends up happening is you will then, when you go back to bed, a lot of times, if you're looking and watching people sleep, they will not go back into deep sleep. So that's one of the things I really talk to my patients regarding sleep hygiene is if that's your habit, it would be so beneficial for you to work on shifting that so that you're not falling asleep somewhere where you're not supposed to be and then waking up and then having to go brush your teeth or do whatever you need to do and then go to bed because you may be losing out on that deep sleep. All right, so just to give you guys a little visual example of sleep anatomy, here is my own personal data from my bio tracker, which I use something called an Aura ring. That's my Aura ring. And here you can see that it will tell me my efficiency. This is a single night of sleep, something called restfulness, my percent of REM sleep in minutes and percentage, my deep sleep, the latency, the amount of time it takes to fall asleep, and the timing. And then on the bottom, you can see the graph, and you can see that the white is awake, the bright sort of turquoise, aqua, is REM, and then there's a lighter teal, which is light sleep, and then a darker teal, which is deep sleep. So I like to look at the little graph, and you can see that that night, bedtime was 10:05 p.m. I fell asleep pretty quick into deep sleep. I woke up, and then I went into a bulk of a lot of deep sleep between probably 10:30 to 2 a.m. You can see all of that. That's my entire deep sleep in that first 4 hours of my sleep. And then if you look from after 2 a.m. onward, you can see that most of the bulk of my REM was happening in that second half of sleep. And that is kind of an appropriate graph if you're looking at it. And then if you want to look at percentages, the REM sleep was 21%, which is on target. The deep sleep was 29%. That was a really good night. I'm bragging for you guys, but anyway, latency was 10 minutes, so that's pretty good. That's within your 20 minutes. And the timing was optimal, meaning my bedtime was 10. I woke up around 5:42 a.m. Very specific. I'll talk a little bit more about different sleep trackers at the end for you guys, but I just wanted to show you those sleep stages and what I was discussing. All right, so we are going to transition. If you need a stretch, take a stretch. Now we're going to delve into the dangers of sleep disorders. So things that happen when you don't sleep. And for some of you who may not know this, in 2014, the CDC declared that sleep deprivation was a public health epidemic. And as you all have probably heard all these words now, you know what a pandemic is, which is a global situation. An epidemic is a more specific location. So this would be an epidemic in the United States of America, which is we're almost all sleep deprived. If you look at the percentages of sleep deprived adults and sleep deprived children, it is pushing levels that are pretty scary. Up to 2/3 of adults could be considered sleep deprived. So this is obviously a very important thing for us to be looking at as a foundation of health. All right, what are some of the things that we absolutely know sleep disorders can cause or be risk factors for? So here's a short list of some of the things I think are interesting and want to talk about. Sleep disorders themselves are extremely prevalent in neurodegenerative diseases. So these are things like dementia, Alzheimer's disease, Parkinson's disease, depression, even things like ADHD and ADD in children, any of the neurodegenerative diseases actually have a very close link with sleep disorders, meaning sometimes sleep disorders, well, most of the time they think sleep disorders arise before the neurodegenerative disease state does, and it is one of the risk factors for propelling patients into some of these brain breakdown diseases. An interesting note about Parkinson's disease, there's something known as a REM behavior disorder. This is a disorder that occurs during REM sleep, which REM stands for rapid eye movement sleep. The REM behavior disorder is when patients enter REM sleep, instead of their muscles being atonic, which is supposed to happen, they will actually start acting out violent or vivid dreams in their sleep. And so these are the situations where you've heard where it's like somebody like slaps the person they're sleeping with, or like starts kicking and has some strange aggressive movements while they are sound asleep. That's known as a REM behavior disorder, and it is known to occur years before Parkinson's disease develops. So if this is ever something you've noticed in a partner, or somebody has mentioned to you, it would be beneficial for you to bring that up with your primary provider and have a discussion about any risk factor for something in that neurodegenerative disease spectrum. We also know that sleep disorders are a major risk factor for cardiovascular disease. This can be anything such as hypertension, diabetes. Obesity is actually known to have sleep disorders that can cause it, heart attacks, and stroke. We also know that sleep disorders are risk factors for maybe improper or bad behaviors, such as being physically inactive, or smoking cigarettes, or having excessive alcohol intake. So having a lack of sleep or a sleep disorder can then cause people to not want to move or not be active. It can cause them to have addictive seeking behaviors to try to buoy up what's going on in the background from the sleep disorder. We also know, as we heard from one of those studies, sleep disorders are risk factors for immune system impairment. And many of you know that sleep disorders are risk factors for things like motor vehicle accidents. If you are sleep deprived and driving with severe sleep deprivation, it can be as risky as driving drunk. And the final thing is sleep disorders are also risk factors for aging. And this is a really interesting concept to think about, at least for me, because when you delve into a lot of the research on sleep, one of the things that you start to unravel is that as individuals age, they say that a process of normal aging is that people tend to have less deep sleep and less REM sleep. I kind of think about, well, are there actually other things going on that are predisposing people to start to have decreases in these very particular important phases of sleep that then stimulate the aging process? We'll talk a little bit more about that as well. All right, so the deep sleep. What happens in deep sleep? So we have so many benefits that occur during deep sleep. A few of them are listed here. There's something known as growth hormone, which is a very important hormone. It is secreted only during deep sleep. That's the only time that we actually secrete this particular hormone, and growth hormone is important to repair and regrowth. It builds bone and muscle and connective tissue, and it strengthens the immune system. We also know that deep sleep particularly has an impact on the brain. It also has something to do with the glymphatic system, which I'm going to be talking about in the next slide. If you've never heard of it, get excited. It's very cool. And then we have benefits of deep sleep in the cardiovascular system, and it counteracts the pitfalls of aging. All right. I don't know how many of you have heard of glymphatics. I assume many of you have heard of something called lymphatics, which is a system across the entire body that helps to get rid of waste and move fluid. But glymphatics happen in the brain. And what's really interesting about glymphatics is this was not discovered until 2012. So this is a very, very new discovery. And I actually remember where I was when I first learned about it, because it was so cool to all of us science geek nerds. Um, I'm, yes, I'm embarrassed that I just admitted that to you all. But yes, I remember where I was when I first learned about this system. And essentially, what we used to believe is that the brain was a completely closed system, and that all of the waste products that built up in the brain could never leave. They were just there, and we didn't actually know what happened until they discovered glymphatics. And this is the system that gets rid of metabolites and proteins and toxic buildups, and it cleans and cleanses the brain. And you know, at this point, I think a lot of people are like, well, yeah, that makes a lot of sense, but we actually didn't know this existed for a very long time. Now, the key is that this brain cleanup only occurs during deep sleep. It will not happen any other time of the day. So if you do not enter deep sleep and have enough deep sleep, the toxins and the buildup inside the brain will accumulate. And this is very directly tied to many, many of the downstream effects that create neurodegenerative disease. So hence why I'm loving deep sleep, and I'm definitely interested in all my patients getting a good amount of sleep. There's also this study here on the screen, talks about the changes of sleep as we age. And this study particularly found links between aging, sleep deprivation, and an increased risk of Alzheimer's disease. So as we know, Alzheimer's disease tends to be a disease that happens as we age, and there is direct correlation between the loss of deep sleep and the accumulation of Alzheimer's disease, because essentially in Alzheimer's disease, we're having these amyloid beta plaques that are accumulating in the brain, and these plaques can actually be cleared during deep sleep through the glymphatic system. Cool, right? All right, let's continue with brain. So aging changes include reductions in deep sleep percentage, decreases in REM, and then other changes that we'll see in the sleep EEG. So in fact, they say that during normal aging, there will be a decrease by 75 to 80% of the total amount of deep sleep if compared to a child. That is a pretty significant number. The change in REM sleep, it goes from approximately that 1 to 2 hours down to maybe 40 to 50 minutes. So there's almost a 50% or more reduction in REM sleep during the normal aging process. Then if we think about something known as mild cognitive impairment, which is the earliest stage of dementia, we find that there's even more reductions in slow wave sleep. So mild cognitive impairment, these individuals have a much worse deep sleep, slow wave sleep, much worse percentage of REM, and disruptions in many different systems. We also have research that shows that the evidence from Alzheimer's disease supports a beneficial role of slow wave sleep or deep sleep in preventing neurodegeneration. All right, here is 2 different studies that I thought were interesting enough to share. The first was on 129 patients with Parkinson's disease. They actually followed this cohort for 4.6 years. And what they found is that the patients who had a higher accumulated percent of deep sleep had a much slower motor progression. Parkinson's disease affects the skeletal motor axial skeletal system and the ability to move and have very clean movements. And they found that that progression of issues with their movement was slower if in the patients who had higher deep sleep. So I like that. That's very interesting. And then this second study was on children with ADHD. 50 children. And what they found is that the children with ADHD in general show a significant reduction in slow wave activity or deep sleep across the whole brain compared to those without ADHD. Now, what else was very interesting about this study was that they did a subgroup analysis, meaning they looked at the individuals who were taking a stimulant medication, such as something like Ritalin, which is a very well-known medication for those children. They looked at those who were taking stimulant medication during the study. And what they found is that the patients who were on stimulant medication actually did not have the same decrease in slow wave activity. And one of the things we know is that children with ADHD have a smaller gray matter volume in their brain. It is significantly smaller than age-matched children without ADHD. And one of the other things we know about Ritalin and other stimulant medications is one of the ways that they act in the system is they will actually normalize the gray matter volume of the brain. So those children, even though you think this is a stimulant medication, so you would think that that stimulation might affect their sleep. It actually improved their slow wave activity and deep sleep. Now, I'm certainly not advocating necessarily that children should be doing that one way or another. There's other things we can think about for activating that increase in gray matter volume, but it was very, very interesting study to look at. All right, let's talk about skin health. So you've heard of beauty sleep. Well, there's truth to it. We know that sleep disorders are risk factors for premature skin aging. Sleep quality is vital to the growth and renewal of the body's systems, and that certainly doesn't exclude our largest organ, which is the skin. Estee Lauder sponsored a study at Case Western University, and it showed that poor sleepers had increased signs of skin aging. This would include fine lines, uneven pigmentation, and reduced skin elasticity. They also found that they had slower recovery from a variety of environmental stressors, this disruption of the skin barrier and UV radiation. In fact, they found that recovery from sunburn was worse in poor quality sleepers, with the redness remaining greater than those who were sleeping better for over 72 hours. They also found that if you test against moisture loss or skin barrier authenticity, that good quality sleepers have much better skin barrier and less moisture loss than poor quality sleepers. So got to get that beauty sleep. All right, so the cardiovascular system, as I mentioned before, many different cardiovascular diseases are known to have sleep disorders as a risk factor. This was a really interesting study I did want to talk about, which has to do with hypertension or high blood pressure. And this is a very large study. This is 1,850 people. Average age was 59.4 years old, and it was about half and half, 55% female. The study went for 5.3 years. And the key here is that all 1,850 people had normal baseline blood pressure readings. So no one who entered the study had hypertension. And then what they watched is over that 5.3 years, how many people developed hypertension. And they found that 30% of those individuals developed hypertension. Now, what they did is they placed everyone into groups based on the percentage of deep sleep. So the first group were getting less than 9.8% deep sleep. The second group was getting 9.8 to 17.7% deep sleep. The third group was getting 17.7 to 25.2% deep sleep. What they found is that those who were in the first two groups had significantly greater odds of developing high blood pressure compared to the third group. Now, what's very fascinating is that these findings were independent of other situations, such as sleep apnea or sleep fragmentation, showing us that it is almost exclusively correlated to this percent deep sleep. So obviously the takeaway here is that for our cardiovascular health, we're really interested in maybe tracking and looking at that deep sleep and trying to push that deep sleep into that 17 to 25% range. All right, so timely times to talk about the immune system. I know we briefly talked about it before, but slow wave deep sleep represents the major origin of the boosting effects shown on sleep immune defense. Specifically, growth hormone, which we already talked about, but also melatonin. These are activated during slow wave sleep or deep sleep. And both of these hormones exert synergistic actions on the immune system. For instance, they help your immune cells to activate, they help your immune cells to proliferate or become more, they help them to differentiate, meaning they help to decide if they should be neutrophils that fight bacterial infections or lymphocytes which fight viral infections. They also help to produce cytokines. What we know and what the research shows us is that even mild restrictions of sleep, so a mild restriction going down from 8 hours to 6 hours of sleep a night for 8 days, just that mild restriction created heightened levels of pro-inflammatory cytokines, meaning immune system markers that are going to stimulate inflammation in the system. This low-grade systemic inflammation from the decrease in sleep is associated with type 2 diabetes, cardiovascular disease, and all the other things that I've just been talking about. Also, the increases in the inflammatory markers after just these 8 days of sleep loss are in the same range that you might see in individuals who are at risk for developing cardiovascular disease in the future. So really very, very key when we're thinking about the immune system, we want to be targeting for that 8 hours of overall sleep to really help it function. So this slide has a very current, from June 2020, research article, which says COVID-19 melatonin as a potential adjuvant treatment. Now, I am not speaking at all on anything that I would recommend for COVID-19 because there is no known treatment for it, but everything that's on this slide has been lifted specifically from this research article, and because it is a published research article, I can show it here, but you're welcome to read this paragraph. But essentially what it's talking about with the immune system is that based on the clinical features, the pathology, the pathogenesis of acute respiratory disorders, which can be caused by coronaviruses, the evidence suggests that excessive inflammation, oxidation, and an exaggerated immune response is likely a contributor to COVID-19 pathology. This leads to a cytokine storm and subsequent progression to acute lung injury, acute respiratory distress syndrome, often death. Melatonin, which I'm going to be talking about in just a minute, but also melatonin that is secreted during your deep sleep and during sleep, is a well-known anti-inflammatory and antioxidant molecule, is protective against the acute lung injury, acute respiratory distress syndrome caused by viral and other pathogens. So again, if we want to activate adequate melatonin in our system, we need to be thinking about sleep. All right, one last thing that we're going to look at before we transition into something different, but this is a study on athletes, and this is NCAA Division I female cross-country athletes, and they were followed their entire 12-week season. What they found in these athletes, and these are kind of your high-end, high-intensity athletes, is that when their physiological or their physical state was impaired, and they had more demand for restoration or regeneration, the percent of time that they spent in deep sleep was found to increase in order to ensure recovery. So in a properly functioning system, if we go and we have a lot of physical demands on our system, what should happen, the normal response is we should really increase the amount of deep sleep to ensure that recovery, to have more growth hormones secreted to help our bones, to help our muscles, to help our connective tissue. All right. How's everyone doing? We need a stretch break. Are we all okay? Thumbs up. Okay.
Thumbs up.
Awesome. So what we're going to do now is we're going to talk about, okay, so deep sleep's really important. Sleep is really important, but what do we do? What if we're not getting enough? What if we're not getting enough efficiency? What if we're not getting enough duration? What are the things that we should be thinking about? So that's going to be kind of this final part of the lecture where we're going to be talking about treatments to maximize deep sleep and work on sleep in particular. So as an overview, we're just going to look at this page. So there's a lot of practices that we can focus on, and I'm going to be talking about all of these things on their own specific slides. And then there's some nutrients that we're also going to be looking at. So the first thing we want to think about is we want to think about decreasing the things that we know will block or decrease the amount of deep sleep. So we've got alcohol, we've got caffeine, we've got specific medications, we've got something called blue light, and we've got NSAIDs. Now, what does alcohol do? So alcohol is a depressant, and it disrupts the ability of the brain to enter slow wave sleep. It can help people to fall asleep. A lot of patients will come in and tell me that they do use alcohol, or they like having their nightly glass of wine or whatever it is they might drink because it helps them fall asleep, and they kind of are a little shocked when I tell them, well, alcohol actually is not good for sleep, because they feel like, oh, I fall asleep so easily with it. What ends up happening is you might fall asleep easily, but it's going to create very poor quality sleep. You may not actually enter deep sleep at all. Also, as we age, we have something called a blood-brain barrier. And this blood-brain barrier becomes more leaky, meaning it's less efficient or less tight as we age. And that causes more alcohol to leach through the blood to your brain. Hence why so many people will say, oh, I can't tolerate the amount of alcohol I used to now that I'm in my 40s versus my 20s. It's because of the aging process in your brain and this leaky barrier that's occurring. Then we have caffeine. Now, caffeine is anything. That could be from coffee, it could be from tea, it could be from any of your different sources. Even dark chocolate has some caffeine in it. And if you want to maximize your deep sleep, I would recommend, and the research shows, that you should restrict caffeine intake to within the 3 hours upon waking up in the morning. Now, I know some people say, oh, just don't have it past noon. Well, the research shows, depending on what time you wake up, you actually want to restrict it to 3 hours from that wake up. And otherwise, it could potentially affect your deep sleep. Then we have sedative medications. So these are our sleep medications. They are associated with worse cognitive function over time, and they do not improve sleep characteristics. So the sleep anatomy that we're talking about, the sedative medications are not going to help that. In fact, most of the time, they prevent the brain from entering that deep sleep. They may help you stay asleep for the whole night, but they're not going to be beneficial for deep sleep. And over time, the reason they're associated with worse cognitive function is because the brain is not able to enter deep sleep. It's not able to clean out the toxins and have this lymphatic flow happen. And we have worse cognitive development or neurodegenerative disease over time. Now, the second two, blue light and NSAIDs, both have something to do with this hormone called melatonin. And both of these are things that will suppress melatonin. Now, blue light, I would assume that a lot of you have heard of blue light at this point, but blue light is the light that's emitted from electronic screens. So everything we're all looking at right now, or TVs, your computer, your phones, your gadgets, they all give off blue light. And what happens is the blue light, specifically how it enters your brain, it hits your retina, and what it does, it suppresses melatonin up to 3 hours after prolonged exposure. So I really highly recommend that we do a few different things. Either we stop screen use an hour before bedtime completely, or you use blue blocking screen protectors. So there's actually protectors you can buy, or even apps you can do that can block all the blue light. Some of our iPhones have a night shift setting that you can turn on. It's going to block some of the blue light. It's not going to block all of it. So if you really want to be blocking, you should either buy a specific screen protector for it, or you can buy glasses that you wear that block all the blue light. So if you are going to watch TV or watch your computer, if you can wear those blue light blocking glasses, that's going to be much more beneficial. And then NSAIDs, these are non-steroidal anti-inflammatory drugs. These are aspirin and ibuprofen, very common for patients to be using these for all kinds of pain situations. What happens, and this is research documented, is aspirin and ibuprofen increase the number of awakenings and the percent of time spent in your awake stage, and it will decrease sleep efficiency. Ibuprofen specifically will delay the onset of entering deep sleep. So if I have patients who are using a lot of these for pain management, there are so many treatments and therapies that we actually can bring on board to help reduce pain and reduce the reliance of these medications, that it's a really important thing that as naturopaths and at our practice, we really do a lot for pain, because this is not the only sort of detrimental side effect to these medications on a chronic basis. All right. So hydrotherapy, this is a wonderful, as naturopaths, we love hydrotherapy. It means water therapy. This is specifically a study that was looking at passive body heating, taking a warm shower or bath about an hour or two before bedtime, and it could be as short as a 10-minute. The temperature should be 104 to 108.5 degrees Fahrenheit. And what they found is that it improved sleep quality, it improved sleep efficiency, it shortened the sleep onset latency by at least 10 minutes, meaning it helped you fall asleep sooner, and it increased slow wave activity in the early part of the night, which is when we want slow activity to be happening. So that's a great little tidbit, and it only has to be about 10 minutes of that warm water, about an hour or two before bedtime. All right, this was a really interesting study on exercise and movement, and this was just from 2019, so very recent, and it was looking at evening exercise. And what it found was that evening exercise increased REM latency, meaning that pushed out the time when people enter REM, so that means more deep sleep. It increased slow wave sleep by 1.3%, and it decreased stage 1 sleep. However, we have to be really careful here, because vigorous exercise was associated with lower sleep efficiency if it ended less than an hour before bed. So exercise and movement, I think, is something really key. One of the things I do think about with this study that they didn't look at is, if this was exercise or movement, such as walking outside, we know that the effect, the stimulation of having the light and watching maybe the twilight or dusk happen is very helpful for stimulating melatonin. So there might have been something like that going on here. But this is another really interesting thing to note, but also to note that doing vigorous exercise is not going to be helpful for your sleep. All right. So I don't know if anybody's heard of pink noise before. I'm sure some of you have heard of white noise, but pink noise is something that contains all the frequencies audible to humans. So that goes from 20 hertz to 20,000 hertz. Whereas white noise has equal power per hertz through all the frequencies. In pink noise, lower frequencies are louder and have more power. So white noise is kind of like a background noise that a lot of people will put on for, their babies or to sleep. What this is going to talk about is that we should maybe be thinking about something called pink noise. So pink noise in that pattern occurs in lots of natural systems. Your daily heartbeat rhythms have pink noise. Quasar luminosity, which that is a beautiful picture of a quasar if you've never seen one. Traffic flow, nature, the ocean can all have patterns of pink noise. Now, this is a study that was using pink noise to stimulate or see if they could stimulate slow wave deep sleep. Kind of small, 13 participants. And what they did is they delivered pulses of pink noise when the slow wave state of sleep was predicted. And they found that if they targeted the acoustic stimulation to that state of slow wave activity, it enhanced deep sleep and it improved sleep dependent memory storage for older adults. And this was done on an age group of 60 to 84 years old. They also found that the slow wave activity was increased during the entire sleep period compared to the placebo or sham. And they had an overnight improvement in word recall significantly greater with acoustic stimulation, probably due to the fact that there was more deep sleep happening. So this is something that you can easily download. There are smartphone apps. I've listed a few here, Noisily or Simply Noise. There's also a website, playnoise.com. One of these is free. One of them is like $1.99. And essentially you can just turn it on at night. You can direct it for how long you want it to play. Like if you want it to just play for the first 90 minutes of sleep, you can direct that. And then you can have pink noise playing and potentially improve that increase in entering deep sleep. Then we have acupuncture. So we love acupuncture, and there is very specific protocols on using acupuncture to increase deep sleep. Right here, you can see a picture of an acupuncture point. It's called An Mien. That actually translates into peaceful sleep. That's what that point means. So stimulating that point with a needle and then using something called electroacupuncture, which is a little bit of an electric pulsing through the needle, will increase deep sleep, and it will not affect your REM sleep. So if you have access to acupuncture and you're interested in, adding that in on your weekly sessions or sessions that you do, that is a great thing to do. Then we have sunlight therapy. So as humans, we have about a 24-hour circadian rhythm. It's actually not exactly 24 hours. And we have these rhythms because we've adapted to the daily rotation of the earth and the light and dark diurnal conditions. And because of this, we actually have diurnal variations in melatonin secretion, cortisol secretion, and our core body temperature. Those are the three things that are known to be directly related to the diurnal circadian rhythms. And in order to maintain a consistent 24-hour circadian cycle, we have to have an external stimulus, and that external stimulus is light. And what we know is that exposure to high light levels during the morning hours is the most important stimulus. So if there's something that you want to add in to your life to help your sleep that night be better, if you can get out into some sort of sun exposure in the morning hours, that's going to be the most beneficial for stimulating later in the day your melatonin levels. And then cortisol. So I just kind of introduced cortisol. Cortisol is a hormone. It's an adrenal hormone. A lot of people know it as a stress hormone. And what we have here is we have some graphs that I wanted to just show to talk about what happens if cortisol, which is on a 24-hour diurnal cycle, if cortisol levels increase at night, which is an improper thing for cortisol to do. So if you see here on the graph, the red dots and the red connected lines indicate a value of cortisol level throughout the day. And at the nighttime is the furthest to the right on each cortisone and cortisol pattern here. And if you see that at night, the gray zone area is going down, and on this graph, the red line is going up to the very tip top of that normal gray zone. So this is an example of a cortisol spike at night. And what happens with elevated nighttime cortisol is that it's most commonly due to stress. So right now, with the kind of pandemic happening and a lot of stress, a lot of anxiety, I am seeing a lot of cortisol dysregulation. This is from a patient 2 days ago, because I actually run the cortisol levels and the cortisol pattern for patients to check these kind of things. And this increase of cortisol at night is going to impact sleep efficiency. The most common pattern that we're going to see is either an inability to fall asleep or chronic waking up in the middle of the night, often between 1 to 3 a.m. So if that's something that is new or something you've noticed sort of during times of stress, it is something to think about in terms of your cortisol. What are the treatments we think about for cortisol? A lot of stress reduction techniques. So mindfulness-based exercises, meditation if you do it, sort of nighttime yin yoga, anything that you know that's going to help reduce your stress is a very good thing to bring on board. It's also interesting if we can identify meal timing triggers. Sometimes we will see this nighttime increase directly correlated to things people are doing with their diet and their blood sugar throughout the day. But that would be something that, you know, your physician would want to delve into with you, but that can also be something to look at. And then we might consider herbal or nutrient support. There's a few things that can be helpful for cortisol regulation, like ashwagandha, which is a wonderful herb, magnolia bark extract, phosphatidylserine. These are all things that your naturopathic physician could prescribe or recommend for you. All right, let's talk about melatonin. We've been alluding to it the whole lecture, and melatonin is the body's primary sleep promoting hormone. It encourages sleep onset and sleep efficiency. It helps you fall asleep and it helps you stay asleep longer. It's produced in the pineal gland, which is a neuroendocrine organ. It is synthesized from serotonin, which is the little known factoid. So for those of you who are familiar with serotonin as a neurotransmitter, serotonin is correlated with things like depression. If there are low levels of serotonin, there are often going to be low levels of melatonin. The other really interesting fact, and this is very new research, is that in addition to being produced in the pineal gland, we also are seeing that the mitochondria produce melatonin. Now, if you're not familiar with mitochondria, we love mitochondria. They're the powerhouses of our cells. They make our energy. And one of the things that's really fascinating to note is that as we age, we lose our mitochondria. And that is one potential link as well to the progression of sleep disorders due to normal aging could be correlated with the loss of mitochondria. And if we could improve mitochondrial function, we might actually improve levels of melatonin. So this is kind of hot off the press and super exciting. Melatonin is activated and synthesized only when it is dark. And in addition to the circadian regulations, melatonin also has antioxidant, anti-aging, immunomodulation, and anti-cancer properties. So it does many, many different things in the system. Melatonin can be safe and effective in treating both primary sleep disorders and sleep disorders associated with neurological conditions in children and adults. And this is just an interesting study from 2018. It was a double-blind placebo, and it was using melatonin, a dose of 10 milligrams, which is actually fairly high. That's kind of a lot higher than we often would prescribe for just normal day-to-day individuals, but it was using it in combination with exhaustive late evening exercise. And if you remember from previous slides, exhaustive or vigorous late evening exercise is not beneficial for sleep. It's actually going to cause you to get less good quality sleep. But if you pair it with melatonin, what they found is that it's going to increase total sleep time, it's going to increase sleep efficiency, it's going to increase the deep sleep stage and REM sleep. They also found that it was decreasing the amount of waking after you sleep and stage 1 and stage 2 sleep. So that's improvements. And then the next day, they found decreased fatigue and reduced level of muscle soreness when the melatonin was given. So I think about this when I'm thinking about a lot of my student athletes, because obviously when sports were going on, the sports were usually practice was usually happening maybe 5 days a week from 5 to 7 p.m. And then, you know, you should be getting home and getting to bed by maybe 9 p.m. if we're thinking about, you know, our children and teenagers. And this might be something that I would bring on board in these types of situations where there's a lot of vigorous late evening exercise that we don't really have control over. All right, we're going to talk a little bit about the diet because, of course, I can't leave out the diet being a good naturopath. So, what do we know about diet and correlation with sleep? It goes back to something called carbohydrates, and there's a pretty substantial body of evidence that indicates dietary carbohydrates can impact your sleep. And we know that if we manipulate dosages or amounts of carbohydrates, we can affect the REM sleep and deep sleep. So this is a study from 2016, and they looked at healthy men and they randomly assigned them to consume two different controlled diets. The first was a low carb and high fat. The second was a high carb and low fat. And you can see the different grams there if you're curious. And these are the sort of meals before bedtime. And what they found is that slow wave sleep was decreased with the high carb diet relative to the low carb diet. And what we know, the hypothesis here, is that the reduction in that slow wave deep sleep that they observed was related to the degree of carbohydrate oxidation. And if you have a high amount of carbohydrates in your meal, the process that your body goes through to break that down is an oxidative process, and that process suppresses slow wave sleep. So again, if I have someone coming in with sleep issues, I'm going to be looking at a lot of different things. I'm going to be looking at different dietary markers. We're going to be looking at their movement and exercise, their practices, all of those things together, because it can all play a role. And then there's some interesting research on fasting and looking at meal timing. So fasting in various forms, because there's a lot of different types of fasting. There's things known as intermittent fasting. There can be short-term fast. There can be long-term fast. These can all have effects on the body's circadian rhythms. So intermittent fasting generally causes insulin levels to drop and melatonin levels to rise. The process of fasting can also promote the release of human growth hormone due to increases in deep sleep phase that we see with long-term fasting. So this might be fasting like 5 days. And this also includes things like the fasting mimicking diet, which I use in a lot of patients. And you will definitely see that those fasting mimicking diets make a huge increase in deep sleep throughout those 5 days. And often that change, that reset in their deep sleep, can persist and last even after they've finished fasting. And then we also look at meal timing. So we want to think about finishing eating before sunset. This encourages the body's natural sleep pattern, and it's known as circadian fasting. We want to time meals so that sleep onset occurs with an empty stomach. This allows your internal clock in your digestive system and your brain to align so that all the systems go offline for really good sleep. All right, we are getting close to done, so I hope you guys are hanging with me. I'm going to talk a little bit about sleep trackers and wearables, because you might at this point be thinking, so this is great, but I don't know how much deep sleep I'm getting. I don't know how much REM sleep I'm getting, and maybe you would like to know. So that's where sleep trackers come into play. And there are so many of them. There has been a market explosion in these trackers. I'm just listed only a few here. It will track it. The Aura Ring, that's my personal favorite. I can tell you more about why in a minute. There's something called the Dream Watch. There's a headband that you can wear. There's a sleep pad you can sleep on. There's a Garmin watch, particularly the Vivo Smart number 4. So what are the things that I think about when I might want to recommend a device to a patient? Well, I think about what's comfortable to wear, because this is something you have to wear for the duration of sleep and probably every night you're sleeping. So I think things like watches and rings are probably more comfortable than headbands. The sleep pad is maybe comfortable. I haven't tried it out. I would just, it should be comfortable because it's just a pad. And then You may want to be thinking about options for airplane mode if you're someone who's interested in decreasing EMF exposures. You may not want something that's tracking on you and having that EMF go off all night long. So I've actually starred the two on this list that have airplane mode options. So one of the reasons I do love the Oura Ring is because you can turn off Bluetooth, put it on an airplane mode, so then it will not be pinging all night long. And the Garmin Vivo Smart 4 also has that option. Everything else is going to be having EMF exposure throughout the entire night. I've included just another little graph here from a different day, looking again at the sleep stages, but this is again the Oura Ring, and I love the Oura Ring, and I don't have any affiliation with them. They don't promote me. I don't get any kickbacks from them. They don't sponsor me. I did my research about 2 to 3 years ago when I really wanted to delve into sleep and understanding my own sleep, and I determined that the Oura Ring has kind of all the markers I'm looking for and what I want to know. And I really like the display and how it shows you your sleep stages and your percentage of your REM sleep and your deep sleep, which are the most important. It also does some other things, like it will give you your nighttime temperature, which none of the others on here are going to do an overall nighttime body temperature. And there's been some interesting research and use with the Oura Ring right now during the pandemic. The WNBA and the NBA have signed contracts with the Oura Ring so that all of their athletes are actually going to be wearing Oura Rings to track that body temperature marker and all these other things. So there's definitely a lot out there in terms of looking at things outside of just sleep with these devices. Okay. So we made it through. I don't even know how long that was. Okay, 7:45, not too bad. What I'm going to do is I'm going to have the screen up, but this is time for questions. Here's our info again. I'm at Steel Smith Natural Health Center. If you would like to reach us, there's our phone number. If you'd like to follow me on Instagram, there's my handle, and I am going to stop the recording at this time. So if you don't want your questions recorded, I am stopping the recording now. So to everybody who's watching this in the future, thanks for watching.